and welcome back to Let's Talk About It with Kelly. This is my husband, John. He is the trichologist at Freedom Clinic, Toronto. Hi. This is season 2, and our topic today is going to be psychological hair loss. This is going to be a good one.
Yeah.
All right. First question, John. What is it meant by psychological hair loss? Can you explain?
Okay, so psychological hair loss is self-inflicted hair loss. So hair loss that the person causes themselves. So it's not a disease like in a sense that like androgenetic hair loss or scarring alopecia where something in your body is causing the hair loss. It's actually you causing the hair loss.
Wow. Okay, we recently did a show on trichotillomania. What are the other types of psychological hair losses?
So if you remember, trichotillomania is this tendency or compulsion to pull your own hair out. So pulling it out, breaking it off, or pulling it out by its roots. Usually it's broken off, but it's this tendency to pull your own hair. So that's you're causing the hair loss yourself.
Okay,
right?
Yeah.
Okay, so another type is very similar to trichotillomania is trichotillomania, which is basically rubbing the hair off instead of pulling. So your person might be sitting there rubbing to the point that the hair is broken off, okay? Or I even had a case where a person was actually dermaplaning the hair off their scalp. And this was a very complicated case where the person was scraping their hair off, and then when the hair would start to grow back, the person thought it was something else. They didn't realize it was hair growing, or psychologically did not want it to be hair growing, or who knows what, but would scrape the hair off and actually the top layer of skin sometimes. So there's all this damage, this self-inflicted harm on the scalp.
Mm-hmm.
And this actually rolls into another type of self-inflicted hair loss caused by something called delusional infestation.
Okay. What is delusional infestation?
So delusional infestation is when a person thinks there's something on their scalp or inside their scalp, like bugs or mites or something in there causing, that might be causing, they feel like they're itchy or they're burning, or they think there's something in there. They feel crawling on their skin. They have all these strange feelings. But then they try and get rid of them by pulling the hair, scratching the hair, but scratching the skin or damaging the skin so much that it's actually ripping skin off because they're trying to get something out of their scalp.
So they actually believe there's bugs in their scalp.
And so when I do my analysis, I'll try and show them that, there's not actually any bugs in there, and there won't be. There won't be anything. We'll do an analysis. Maybe there are bugs, but we do an analysis, microscopic analysis to see, are there any bugs there? There's no bugs there. There's nothing there.
Wow.
And in this one case where the person was dermaplaning their skin off, hair and skin,
Mm-hmm.
I could see that what was under the skin on the surface was the roots of the hair because they'd been scraped off at the surface, but as soon as they'd start to grow, or as soon as the person would feel the bumps from the hair growing back in,
they would scrape it off?
They would scrape it off.
So, sounds like a nervous system
It's
thing.
Complicated.
Yeah,
It's psychological. It's psychological. But it could also be neurological in some cases. So and this is not psychological hair losses. There are cases where, and I think we talked about this in a previous episode, but people will develop symptoms in their scalp like burning, itching, crawling feeling, all these types of sensations, pain even, that could be caused by some sort of nerve disruption or nervous system, misfiring. So their nerves are causing them to have these sensations, but there's nothing on the scalp causing it or nothing in the scalp causing it. So this is something that can be caused by, nerves. So that's a little different. That's not self-inflicted hair loss, but, the delusional infestation is when the person thinks that there's bugs under and they're convinced. They want drugs, they want antifungals, they want something to treat these bugs that they're convinced.
So they're coming in for hair loss or for the bugs?
So they're coming in for hair loss. Sometimes they come in for hair loss and they're in denial about it, that but they think the bugs are causing the hair loss. Okay. They're in denial that they are actually scraping the hair off sometimes. Some people are aware of it, but most people aren't. Or at least they won't admit to it or acknowledge it. So there's usually some other psychological issues, some other stressors going along with this.
Okay, so there's a couple of psychological things together.
It's complicated.
What about people who think they're losing their hair, but they're not?
So people who think they're losing their hair, but they're not. So this is
a big question.
Sometimes people get told there is no problem when there is a problem. But the other side is when people think they have hair loss and there's no hair loss. This is something we call body dysmorphic disorder, or it's a form of body dysmorphic disorder. Some people have, body dysmorphic disorder about other things, like maybe their weight, and that might cause them to have bulimia or something, or, they're not happy with their ears, so they've got their ears tucked or something like that. So where you have this psychological disturbance because of some perceived imperfection of your body. So we get people who come in who think they're losing their hair when they're not, and they're obsessed. They get obsessed with it, looking in the mirror.
So they think they're going bald, but they're not.
That's right.
They have all their hair.
That's right.
But they look in the mirror and they see themselves bald.
Right.
Kind of like anorexic.
Yeah, they see themselves fat even though they're not fat.
Same
right?
kind of thing. Okay.
Same sort of thing, right?
So what exactly is body dysmorphic
so that's
disorder?
That's when you have a perceived, you have a perceived deficiency of something in your body, and it could be anything. But we see it in relation, to hair. So I see it in a lot of young men. So young men come in.
More men than women?
Usually, yeah, with this specific condition, body, BDD in relation to the hair, more often men. They'll come in, young men, they've got nice, thick, full heads of hair. They might have a very slight recession here that's probably just maturing hairline. So something happens in men and women. It happens in women too, where the hairline recedes a little bit in the temples, changes a bit of shape, okay? But for some reason, the person thinks that they're losing their hair.
Okay, thanks, John. Okay, how does body dysmorphic disorder affect people?
Okay, so this can be very serious.
Sounds like it.
So we had a hair system client for years, regular client. And when I started working in the clinic, he was already a client. Okay, so he had got there when, previously before I started working there. And so he had a hair system. This person had gotten into a car accident at a young age. And ever since this car accident, the person was obsessed that their body was imperfect. They had problems.
Yeah.
He had his ears tucked. He had a facelift. And he had a hair system. So he figured there was something wrong with his appearance, and he was determined to fix it or change it. Well, when I got to know the client, I realized that he actually didn't have any hair loss. He might have had a little bit of a receding hairline, which we sometimes call a maturing hairline. So as a person ages, they might get a little bit of change in the shape of their hairline.
But he didn't need a whole hair system.
He didn't need a hair system, and he didn't even need to worry about his hairline. He did not have hair loss. When his head was shaved to accommodate the hair system. Okay. Now, this particular person liked the hair system. They used it all the time, and it seemed to help them. But in most cases, if someone comes in to the clinic and they're suffering from body dysmorphic disorder, and they're a young man or even a young woman, and they want a hair system, giving them the hair system is usually not going to help them. It's going to make it worse, because now, let's face it, it's not going to look as natural as your own hair. The person's going to have to do maintenance and spend money on this thing. They think they're going to look better and feel better, but they won't. And for this reason, when people come in with BDD, it's better not to treat it, because they're just not going to be happy. They're going to be wasting their money. And, as professionals, we need to recognize this, because, sure, I mean, you could sell him the most expensive hair system. He can become a good client that spends a lot of money in your clinic, but at the same time, you're not helping his disorder. What that person needs is treatment, psychological treatment, right? For body.
And that's not easy to tell somebody that they need psychological treatment,
it can be very, very difficult. And the approach I take is, when a person comes in, I take them seriously. They think they're losing their hair. Yeah. So we do a full analysis.
Right.
And we show them very clearly what's going on. We show them what hair loss looks like, what the symptoms should look like. And we do the tests and the pictures and everything. And we try and show them. And oftentimes, they're, oh yeah, okay. They'll see it, but
they won't believe it.
They won't accept it, or they won't believe it, or they won't accept it.
Right.
Because they have this condition called body dysmorphic disorder.
So what happened with this fella? Did he take his hair system off, or when you told him he doesn't have hair loss?
No, I didn't tell him he didn't have hair loss. He was into it for years before I even met him.
Okay, so you just left it.
Well, we just kept servicing him, and we went on. Unfortunately, what happened, this person was close to us, because these clients come in every month for servicing.
Right.
So we get to know them really well, and he was coming for years. And unfortunately, he ended up suiciding. He passed away from suicide.
Wow.
And obviously, it had to do with his self-confidence was just destroyed because of this body dysmorphic disorder.
Wow.
So it can be really serious.
Of course.
And we need to, this is why we need to be very careful
on how we
treating this. We want to try and get these people into therapy if we can.
Yeah, right. Well, that was the other thing. How should psychological hair loss and body dysmorphic disorder be treated?
Exactly. And
you had another client, I think, John, that came in with his family. I think I remember something
right.
about
Okay.
that.
Yeah. So we need to get people into therapy. We need to treat the underlying condition.
That's right.
The BDD.
Yeah.
So I had a family come in. So it was a father, a sister, and a brother. And the sister was there for support, obviously, and the father. And the young man was really obsessed with his hair, constantly looking in the mirror, swearing that he's losing his hair. He's so worried he's going to go bald. So I did the whole analysis. I took the pictures. I talked to the father. The father had a little bit of thinning on top. So he had some androgenetic hair loss, but he wasn't bald. His father was in his 60s. He wasn't bald. A lot of men go completely bald. He was he had thinned a little bit. Mm-hmm. But this young man was just obsessed with his hair, so worried that he was going to go bald. So I showed him what was going on. Now, when I did the pull test, there was a little bit of extra shedding. Okay. It seemed like it.
Right.
But when we looked on the microscope and everything, the hair was thick, full, normal. There was very little, if any, miniaturization at all. So I couldn't diagnose the androgenetic. At the very least, it did not need to be treated.
Right.
Because
with a hair system.
With anything.
Is that what he wanted? It was a hair system?
No, he didn't necessarily want a hair system. He wanted to know if he was losing his hair and what he should do about it. Mm-hmm. But what I did was I showed him that he wasn't really losing his hair right now, or we couldn't determine that he was. Therefore, you don't need to treat it until we have, clinical evidence that it's actually happening. Okay. And I wouldn't even send a person like that for a biopsy because a biopsy wouldn't show it either.
Right.
Because there was no miniaturization. So you wouldn't see anything on a biopsy that would say they had androgenetic hair loss, or it might say possible very early signs of AGA, and then the person's in a panic again.
Right. So
when they don't need to be.
Yeah.
Okay. So I showed him this. Okay. Mm-hmm. I always do a follow-up a month later. So they come back a month later, the same people again. And
all three of them.
And the daughter's telling me again how obsessed he is, constantly obsessed in the mirror. He won't go out. He's so worried about his hair loss. Again, I emphasized that, if you ever develop hair loss and we have the evidence, then we can treat it. Okay. You don't need to treat it right now. Mm-hmm. So this was a case though, when the daughter said to me, he's obsessed. He's in the mirror all the time.
Right.
And it's affecting his life. I said, you know what? Have you ever heard of this body dysmorphic disorder? And they hadn't. And I said,
Okay.
it's a condition where you think that you have some kind of, deficiency in your body. There's some kind of, you have an insecurity about, about something on your body, some kind of imperfection. And in this case, it's your hair. So and it's a psychological thing. And, there can be various causes, but it is a psychological thing. And it's something, perhaps you should consider getting some therapy for it. There are therapists specialize in body dysmorphic disorders. So, and these same specialists probably, deal with anorexia too and things like that. So I was able to tell them that. A lot of people, though, if you try and tell them, or most people, if you try and tell them they need therapy, it's very difficult. It's
for sure.
They reject that outright. They hate being told that.
Yeah.
But when you have somebody with body dysmorphic disorder, or somebody with trichotillomania or trichotillomania or delusional infestation, they need therapy.
They need that.
This is the
all.
treatment. This is the treatment they need. They don't need a treatment for hair loss. Okay. Because, even these people that self-inflicting these wounds on the scalp and actually removing skin and hair, and sometimes causing permanent damage. If they just leave it alone, the hair will go back normally.
Yeah, but it sounds simple, but I don't think it's that simple.
God, it's
now.
Not.
To me, it sounds like that this is kind of alongside of OCD, alongside of,
Well, OCD is a big part of trichotillomania and trichotillomania. Yeah. There's always other psychological disorders associated with these self-inflicted hair loss conditions, for sure. And
paranoia too.
Yeah,
probably.
I mean, it could be a lot of things. Can't leave the house. Yeah,
kind of thing.
Yeah, you become antisocial.
So I mean, it's not just this; it's other things too. So on your questionnaire, do you have something on your questionnaire that says anything about?
No.
They don't talk about that.
Well, it's common, but it's not the most common thing. Obviously, I probably see one a month with body dysmorphic disorder.
Wow.
I probably see one a month with trichotillomania. I probably see now trichotillomania. It's much more common and much more well known and much more understood. And most people with it know they have it, know they're doing it. Most people do. Some people are in denial about it, but usually the denial comes with the more severe cases of trichotillomania and delusional infestation. Those are the ones, they're much more serious and they're much more harder to treat, because usually people are in denial about it because they've inflicted all this destruction onto their scalps. It's very bizarre, and sometimes other parts of their body. I've seen cases of delusional infestation where the person has it all over, in various areas of the body. They'll have wounds where they've scraped their skin off because they think there's something underneath. And, they're coming to me because they have all this hair loss, but it's them that have removed it.
Wow. That's scary now.
It's scary.
It's good we're talking about this, because all the listeners out there, if you know somebody that is like this, there's names for it. It's a real thing.
Yeah.
And they need help.
Yeah.
And
it is a real thing. And this is really important, because I've had people with these types of conditions come in with their kids. So a mother coming in with their daughter.
Trying to get her help.
The family member often knows what's going on, but the actual person doesn't accept it.
They need somebody like you to tell them.
So they need somebody else to reinforce what if possible. But the approach I take is to use the tools that I have to show them exactly what's happening. Okay? I can show people that, this hair has been broken. I can show people that, this hair is growing back. Okay? So there's things that I can show them.
You can show them they don't have bugs.
Yes, exactly. But it often doesn't help. These are the types of cases, that sometimes I lose sleep over.
Right.
Because I'm worried about these people, because I know how far this can go. This can get really bad.
Yeah, I know, John. I know. So what advice would you give to people who are suffering from psychological hair loss? What would you say? What would you say to them, Ben?
Most people aren't aware of it, but if there's a family member, then that family member really has to help by, coming to see me may help them, but it probably won't. What they need is therapy. So somehow we got to get You got to get these people into therapy. If I can help, so I'm totally willing to, see these people and help them as much as I can. Maybe they do need a temporary solution, like with the trichotillomania, we put hair systems on people, and that stops them from touching their hair. They can't pull it anymore. And I've actually tried to get a couple of other people into hair systems who are destroying their scalps, because if I can get them to wear a hair system permanently, they'll stop ripping their scalp apart. But
if they're not losing their hair, then you don't put a hair system on.
No, like in the case of body dysmorphic disorder, we wouldn't do that. Okay. But in a case of, where we need to stop them physically from touching, we might consider that. But again, it's probably something that probably wouldn't help much. It's very difficult.
So you can't treat them. You tell them exactly the way it is. Now
I try and show them what's happening. I give them, I can show them, there's no bugs. Okay.
Right.
Or what's causing it. So one person I did get referred to a neurologist, because they had some sort of neuropathy that might have been causing them to feel these conditions in their head, in their scalp. Some people come in and they'll have all these feelings in their scalp, and they're not ripping their hair out. But it's not psychological, it's neurological. Okay. There is something happening, although there's no symptoms. There's no evidence of it. I shouldn't say there's no symptoms. There's no evidence. There's no redness in the scalp. There's no, fungal infection. There's nothing going on there. And they've gone to their doctor, and the doctor said, there's nothing wrong. Everything's fine. But they're like this, people sometimes can't function. It's keeping them up at night. Their scalp is hurting, burning. Do you do a biopsy? Maybe do a biopsy, see if it's an early stage scarring alopecia, but usually there are signs of that. But sometimes it's neurological.
For these people that actually need psychological hair loss with a therapist, do you refer them out?
I'm in the process now of trying to find specialists that we can refer to.
Because it's not that easy to find.
It's not that easy to find a specialist in this field.
Yeah.
So we are looking into that to try and so that we can put these people on the right path. Often many of them already have therapists. It's surprising. Yeah, often they do. They're already in therapy, maybe for something else like OCD or some kind of trauma. Or a lot of it might be related to post-traumatic stress.
Yeah. Okay, that's great. Thank you, John.
You're welcome.
So we'll see you next time. Thanks, everybody.
All right.
Bye.
Bye-bye.